Hi KK, how are you? I'm fine Shetty, how are you? I'm also fine boss. So Shetty, the cardiologist, how is your practice going man? It's a roaring practice my friend. So how are you? How is your community medicine job going? Are you happy? Yes Shetty, I like my job so much and I love to teach, do research and to innovate new things in public health. Then what else I want? Hey, what do you teach them man? First of all, what is the need for community medicine for MBBS students? Even my professor Dr. Devi Shetty recently recommended to remove community medicine from MBBS syllabus. What's your opinion, KK? Shetty, what's your opinion? I too think the same, man. What's the need for community medicine? Okay, Shetty, I will ask you some questions. Answer me. Okay. Now you are a leading cardiologist. You are seeing so many patients every day. What medicines you commonly use, Shetty? Well, I use aspirin, antihypertensives like beta blockers, ACE inhibitors, and some statins to reduce lipid levels. Who gave you the confidence to use these medicines, Shetty? Pardon? I asked who gave you the confidence to use the same medicine for so many different patients? How do you know that these medicines will work and they will not cause any harm to your patients? KK, that's why we study MBBS man. We study pharmacology books and medicine books. Okay, so you read from books. But how did those books get these details about the drug efficacy and safety, Shetty? There are thousands of drugs and medicines in allopathy, Shetty, and lakhs of medicines will be discovered in the future. And it is the research studies like randomized control trials, which we study in community medicine, that gave the confidence to prove the safety of the medicines we use in day-to-day practice, Shetty. Okay, Shetty, my next question is, do medical representatives meet you with some new drugs, Shetty? Yes, KK, regularly they meet me. So how do you decide to use that drug or not to use that new drug suggested by the medical reps? Well, I'm not like some other doctors, KK, who decide based on the monetary or non-monetary benefits. I choose based on the evidence. That is, I look for research studies done on the efficacy and safety of the new drug. Only after I interpret properly about the quality of these studies, I decide to use or reject the new drug, KK. So where did you learn to interpret the quality of the studies? Of course, from community medicine only. From epidemiology and statistics chapters, I get a basic understanding about research and research methods. Okay, how many patients you see per day, Shetty? Around 50. And your clinic timing? Morning 4 hours, evening 4 hours. So 50 patients in 8 hours. So roughly you spend 10 minutes per patient, correct? Do you give any counseling to your patients, Shetty? CKK, my specialty is cardiology. Preventive care is very important. So I spend most of my time in communicating to the patients about physical activity, diet, personal habits, etc. Cardiology practice is basically behavior change communication, KK. So where did you learn about health communication, Shetty? From our legendary John Everett Park and Park Community Medicine only, KK. Do you see many communicable infectious diseases like tuberculosis or leprosy in your clinic, Shetty? Rarely I see tuberculosis and very rarely I see leprosy cases, KK. So do you think there is a reduction in the incidence of these big public health diseases? Definitely, KK. I think there is reduction in the incidence of these infectious diseases compared to olden times. So what could be the reason for reduction? Maybe I think community medicine people always talk about the national health programs now. Because of these national health programs, there could be reduction in the incidence of these old infectious cases. Alright, Shetty, your wife is your obstetrician now. How is her practice going? It's also going well, KK, but not like me, you know. These days people are very sensitive about pregnancy and childbirth. If some mistake happens, the whole hospital is sued for negligence. So she spends most of her time with her patients in educating them about preventive obstetrics, rest, nutrition, what to eat, what not to eat, etc. etc. So her patients are happy and practice is going smoothly. Oh, I see. So where did she learn preventive obstetrics? She says it is the chapter on preventive obstetrics which she learnt in park is the source of her knowledge. Not only preventive obstetrics, Shetty, the basic management skills for basic problems we see in day-to-day practice like diarrhea, respiratory infection in children, how to assess them, how to treat them or refer them, everything is clearly explained with flowchart in community medicine, Shetty. You see, Shetty, our country India doesn't have family medicine as a separate specialty like in most of the developing countries like UK and USA, where family medicine is a separate specialty. So it is community medicine in India which is playing the equivalent role of family medicine in abroad. Okay, KK, I think you are leading me towards a place where community medicine should be the bulk of all specialities. And this is not my intention, Shetty. Okay, one more question. What is your view about community medicine people always interested in waste management, sewage, sullage, mosquitoes, house fly, sand fly, this fly, that fly, etc. etc. KK, you should not feel bad. Okay, I understand. You feel it is the dirty part of community medicine? No, KK, why should a doctor know about solid waste, sewage, sullage, mosquito, etc.? Municipality people are there to clean up that mess. Public works department is there. They will take care of cleanliness. What is the need for a doctor to know all this dirty stuff? Correct, Shetty. Municipality is there. But what is the use, Shetty? How is our country's sanitation? How is our country's waste management? Be it solid or sewage or sullage, we are nowhere near any developed country in the world. Do you know Great Sanitary Awakening, Shetty? In 1800, that is some 200 years ago, UK, Germany, France, like all these developed countries had a huge problem of tuberculosis, leprosy, plague, cholera, typhoid, everything was there. But today these countries have zero incidence of all these diseases. Why? Because of Great Sanitary Awakening. The awareness is yet to come to India, Shetty. India doesn't have a strong setup for public health and there is lack of public health as a separate specialty in India. So community medicine is considered as the equivalent of public health in India. So what are you, KK? Community medicine specialist or family medicine specialist or public health specialist? Jack of all, master of none. See, there is an old saying, prevention is better than cure. We in community medicine work hard to prevent disease rather than treating it. We are always worried about health rather than disease. So I would say we are health specialists rather than disease specialists. When clinicians are interested in agent factors, we are interested in host factors, that is social factors and environmental factors which no other specialty in medicine deals with. I am really sorry for degrading community medicine. After talking with you now, I realize its importance. Are you angry on me, KK, for initially degrading community medicine? No, not at all, Shetty. My intention is that nobody should degrade other specialties. If I say intervention cardiology has developed so much, so what's the need for cardiothoracic surgery as a separate specialty? Let us remove it from the specialty list. Whether it will look nice, it will not look nice now. Only this is my point. Nobody should degrade other specialties. We can maybe add specialties, but we should not degrade any specialty and we should not speak ill about any other specialty.